Hi, I'm Julie Schwartz. I'm Coordinator of Nutrition Services at Emory Bariatric Center. I oversee our team of dietitians and also ensure that our nutrition recommendations and lifestyle recommendations are evidence-based and up to the last recommendations. At Emory Bariatric Center, we offer a whole host of services to meet your pre-surgery, post-surgery needs, and also as an alternative to surgery. Pre-surgery, we also offer services to help meet the requirements for insurance so that you can get pre-qualification of insurance reimbursement. This can last anywhere from 3 to 6 months, and it's up to you to determine from your insurance company what is your requirement. During this time, we are going to start working on the lifestyle changes and recommendations that are essential for your surgery and your tool to be effective, and also so that not just weight loss happens, but weight maintenance over your lifetime. We also offer services in our comprehensive weight management program for individuals whose BMI is greater than 60 so that they can lose the weight to meet the needs from our surgeons to qualify for surgery. And that way it helps to reduce your risk of actual operation complications. In this comprehensive weight management program, we use the OptiFast program, and we talk about lifestyle change, but also a very low-calorie meal replacement program for quicker and more consistent weight loss. We at Emory Bariatric Center promote surgery as a tool to successful weight loss and weight management. As that, we know that lifestyle is so vitally important, as you've heard from many of our surgeons today. We require a group nutrition class prior to surgery. In that class, we are going to go over the evidence-based practices that lead to weight management for a lifetime. We are also going to go over the diet progression that helps your GI tract reintroduce food and reintroduce a new way to digest that food, regardless of which procedure you choose. During the group nutrition class, we are going to go over our 10 key points for success post-surgery. One important aspect of success is setting and reviewing weekly goals. What are you going to do this week? Not just about your health, but it's important to include your life. What life goals do you have this week? Because they all have to integrate for the goals to actually be successful. We also recommend attending our monthly support group. It's professionally led so that we can make sure that we're clearing up any myths and misconceptions. Research shows that people that participate in 6 to 24 months of support following any type of weight loss have a much better chance of lifelong weight management success. We also recommend that you move daily, exercise weekly. The best message that I can portray is move. Move a little. Anything is always better than nothing. Choose nutritionally balanced plan. Post-surgery, people hear the message protein, protein, protein. If a high-protein diet worked, we wouldn't be speaking today. We talk about protein in the early phases after surgery because the amount that you can eat is so small. It's about 2 tablespoons to 4 tablespoons of food for the first month after surgery. But over time, your pouch will gradually expand a little bit so that you can eat a more normal-looking small meal. At that point, we want you to be getting your protein normally from food, but if you cut out all those carbs, you're going to cut out all your energy. So we're looking about balance. The other part of the diet balance is that those healthier foods are easier to chew. If you chew your food, you're going to tolerate your food, and it is a key essential ingredient to lifelong tolerance and acceptance of food into your body. If you're chewing your food, you will be eating more slowly, and that leads to our next point. Eating slowly is known to help with satiety and weight management. We in America consume our meals in about 11 minutes. It takes 20 minutes approximately for the signal from our stomachs to get to our brain that we're satisfied, let alone full. So when we're eating so quickly, it's easy to see how we can overeat and overconsume. We also recommend that you make sure that you drink enough fluids. You still need at least 64 ounces of basically non-calorie, non-caffeinated beverage in your day. In the early phases after surgery, this can be challenging, but later on, it will become normal. If you adopt a really healthy exercise and physical activity pattern, you actually may need more fluid than this. Another thing that's important is to eat and drink at separate times. This is a key difference between post-surgery and pre-surgery or without surgery. What happens is if you eat and drink at the same time, some people think, oh, it gets your stomach pouch blown up or you get sick. Really what's happening is you are pushing that food out of your pouch and then you have an empty pouch. If you have an empty pouch, you have a hungry pouch and you're going to need to eat. So it's important to wait at least 15 minutes after drinking before you eat and at least 30 minutes after eating before you drink again. How much time will really depend on which procedure you choose. This is a key to managing your weight. More than anything else, this is what we dietitians see people missing when they start to regain weight or stop losing weight, is they come back to that old pattern of eating and drinking at the same time. Pre-surgery, it's a benefit. Post-surgery, it's a hazard. It's also going to be important and vital to take your recommended vitamins and minerals for life. This is going to vary again depending on your procedure. With the gastric sleeve and the lap band, in general, we're going to recommend that you have a multivitamin with iron and possibly calcium citrate for life. Just as simple as that, really the volume of food is so small, it's just an insurance policy on your nutrition. If you choose gastric bypass, the regimen is going to be a little bit more rigorous, and this is ensuring that you don't have nutrition deficiencies. Research overwhelmingly shows that people that have severe nutrition deficiencies post-bariatric surgery are those people that quit taking their supplements. Last but not least is limiting the high-fat, high-sugar foods in your meals and your diet. We're recommending limiting. So as I leave you today, I want to challenge you with a few things. Why wait to lose weight? Why wait to get started until you have surgery? Practice. Move more today than you moved yesterday. If all you can do is 1 or 2 minutes, that's fabulous. If you can do 10, 15, 20 minutes, that much better benefit. But start where you're at. Eat fruits and vegetables every day. Choose the ones you like. Choose them in the way that you like them, but choose them. Enjoy your food, slow down and taste it. Most people inhale their food. There's no way that you're enjoying your food. I usually like to ask the audience how many people enjoy their food, and most people laugh because, I'm overweight, so I must enjoy food. But if you're going fast, you aren't. Savor the food. Feel how it feels in your mouth. Taste it. Usually the taste sensations are strongest in the first 1 to 3 bites. Sometimes when you slow down and taste your food, you're going to cut out some food options because you're going to find there's some foods that you are eating that really don't taste good, but you can't tell when they're flying by the taste buds. Be positive. Diets are negative. They tell you what you can't do, what you shouldn't do, what you should have done. It's all about guilt. It's all about what you didn't do. You didn't do it. Well, this is about what did you do. Every day, what did you do positive for you? What's one thing? One thing. Everybody does something positive. This process also helps heighten your self-esteem. If you're feeling better about you, you're feeling more in control, you can keep on going. So until we meet again, the choice is yours. Choose to move, choose to eat healthy, choose to do something that's in your control. And the surgery, if that is your choice, will help you with what's not in your control. Thank you. Until we meet again.